So the next 10 minutes I'm going to be spending with Michelle Baker Jones and Leonie Schneider to talk about their involvement in the Psilocybin for Depression trial from Imperial College. But just to briefly introduce them both. So Michelle Baker Jones is an integrative psychotherapeutic counsellor in private practice based in London. She is also a member of Imperial College's Psychedelic Research team and was a lead guide on the Psilocybin for Depression study. She also offers individual psychedelic prep and integration for people who are struggling to process psychedelic experiences and co-facilitates a monthly psychedelic integration group with Richard Jones. Michelle is also co-facilitates a sharing circle with the clinical team of Synthesis. She will also be the lead therapist on an upcoming DMT trial, which will look at the potential of a longer infusion of DMT as a treatment for depression. And Leonie Schneider was a participant in the Psilocybin for Depression study at Imperial College in November 2019 and has experienced firsthand the transformative and life-enhancing effects of these medicines. To say her life was changed is an understatement, and Leonie is now committed to expanding access to these psychedelically assisted therapies and is retraining whilst deepening her own personal practice. Previously, Leonie hailed from a policy and research background in international development, focusing on connecting people via access to the internet and technology. Now she is focusing on connecting people to themselves, each other, and the planet through these medicines and therapies. While studying, Leonie is also working part-time at the as a psychedelic retreat coordinator for Alalaho. Did I say that correctly? Formerly the Psychedelic Society Experience Retreats. So I'm going to open with a question for you, Michelle. And if you wouldn't mind just providing us with a brief overview of the design of the trial and perhaps identifying the primary aims.
So basically the trial was a mechanism trial comparing psilocybin with a standard SRI. And so it was a randomized control trial, and half the participants would receive 2 high doses of psilocybin, and the others would receive a very low dose of psilocybin and escitalopram. So, and that the idea of the trial was to compare really which was more effective.
Amazing. So we had a psilocybin arm and a antidepressant arm. Is that right? Yeah. Thank you. And Leonie, how did you find out about the trial and what led you to apply?
A couple of things. I've had a long-term interest in psychedelic medicines and how they've been used in indigenous cultures. So I've been long-term interested in this. I think what prompted me to apply was having read, as many people have, Michael Pollan's book, which really brought the whole field of psychedelic research and the trials that are underway into the public domain, mainstream conversation. And then a spot of Googling, because I really knew that if I kept on doing what I was doing, I was going to keep on getting the same results. And I was really looking for something different to shake up the snow globe, so to speak.
Yeah, I love that analogy of shaking the snow globe. So am I right in understanding that Michelle, you worked with Leonie as her guide? Do you want to tell us a little bit about what it's like guiding on a trial like this?
So so we initially meet the participant in the screening session, and that session is quite important because we're just establishing a rapport and seeing whether we feel, and obviously that has to be established quite quickly. So it's really about assessing whether we feel we can work well together, and getting to know a bit about their psychological history, and thinking, kind of giving some psychoeducation about what to expect on the experience and sort of covering taboo subjects that might arise, and encouraging them to really, I suppose, adopt an attitude of curiosity and openness towards the experience. So it's kind of being brave, and so we wouldn't speak about a bad experience, but just challenging experiences. And quite often there's a sense that, you know, whatever arises, it's about going in and through that. So that's very much the key concept of everything that arises is useful, and that really what we're doing as the guides is we're creating that safe space. So it's really whatever we can do to create that safe therapeutic container. And it's very much, this is, you know, this is the participants' experience. We're just there as say like the cabin crew, just to make sure they have the safest journey possible. And if at any point, you know, there's any turbulence, we'll be there to hold their hand. And often that's something we do very much on the ascent of the experience, just to help them physiologically feel safe and soothed. And then if at any point, you know, they want to come out and talk to us, we allow that to happen, but we do then quite often encourage them to go back in, because, you know, we feel that the medicine basically helps them to more than we can, you know, and we make it clear that we'll have plenty of time and integration to discuss what's happened. And I think, you know, that's something Leonie, I remember Leonie a few times came out and, you know, and then went back in and probably had deeper insights, especially on the descent of the experience, when you think, oh, it's kind of over. But I think, you know, the more you go in, the more you get, the kind of richer your experience is. But yes, it's an honor really to be alongside people, to guide them. And it's not so much what we're just kind of creating the safety, but it's seeing them do that work for themselves.
Amazing. And Leonie, do you want to say a little bit about what it was like being a participant in the trial?
Yeah, absolutely. What was it like being a participant? I came to it with, I guess it's normal to expect some high hopes. Firstly, you're always hoping you're going to get the therapeutic dose and not be on the placebo arm of the trial. Even though you know your contribution is going to help science, there's that real hope that, you know, can somebody else prove the theory? I really want the therapeutic treatment. Because I had long-term low mood and period depression, and had reached a point where just taking a tablet every day was just numbing my experiences of life, really sort of narrow band of experience. And it was just getting weary, really. And I really needed to do something different. Otherwise I would be, it's that quote about madness is doing the same thing and expecting a different outcome. So I had no illusion that going in, that I wouldn't be coming out a completely different person. And I was. I think that safety Michelle speaks of is so important, because I knew that I could really go in deep and really go through any challenges that were coming up. And I was a bit surprised by the experience in that I didn't have what you read in the literature about ego dissolution. I didn't lose myself and become one with the cosmos. I was still very much me doing my thing, which is why I kept trying to convince Michelle that I was on the low dose the entire time. She had her reservations. She thought it might have been something else. But I was convinced I was on the low dose because I didn't have that ego transcending experience. But what I did have is a very real and almost tangible embodied experience of my depression as a heavy coat, actually. That was the image that came out. It was something that was put on me, something that I've inherited, something that represents the patterns of behavior, the automatic responses, the defense mechanisms. And I think for me, the pinnacle of the trial was doing some of this deep work, realizing these layers upon layers that were suffocating and were on top of me and not even really mine in some respect. And taking my mask off, looking Michelle in the eyes and saying, Michelle, I'm surprisingly unbroken. Putting it back on and going back in to carry on spelunking and exploring and trying to get every ounce of medicine I could out of this. And then obviously, that was just the start, a very intense day, but that was just the start. It certainly isn't replacing an SSRI daily with a psilocybin tablet 6 monthly. That was only the start. So, yeah.
Yeah, and I love I can feel, even through the computer, I can feel the trust between the two of you that must have developed throughout the trial. And those are some beautiful kind of images that you speak of there, Leonie. There have been a couple of questions in the chat for the both of you. Michelle, would you mind describing briefly what the setting is like in the trial?
So we yes, it was a very clinical room that we had to transform into something a lot more ambient. So we had screens with lots of trees on. We had many salt lamps. Sadly, a few fake plants because we couldn't have real plants. And we would have, what else? We would have some
Fake
art
candles?
books. Sorry?
Fake candles?
Fake, oh yeah, and fake candles, yeah. So lots of fake things. But I mean, I think it was very homely. We had, you know, a soft brown blanket, I remember, and you know, a few kind of a few, what else? We had like wooden, I think maybe a Shiva, and we had a very beautiful bowl that we put the psilocybin tablets in. So it was a, yeah, it was a bit of a sanctuary, I'd say, rather than very clinical.
Mm. Yeah. And do you have any more to add about what the setting was like for you, Leonie?
Having watched the first documentary about the Psilodep 1 trial, which was very clinical, I'm surprised more people didn't have more challenging experiences in that setting. So I was so pleasantly surprised coming in and seeing something that is a dark windowless room in an academic hospital wing being transformed into exactly that, a sanctuary. As much as you can within that setting. So, and it just goes to show to what extent that is so important, the set and setting for a transformative experience.
Yeah, absolutely. And that actually leads quite nicely to another question that came up. And this is a question that I suppose often arises is across the trial, sort of these trials, how many times do you see quote unquote bad trips? So Michelle, I don't know if you want to speak to that a little bit.
Yeah, I mean, I suppose we would use the terminology a challenging experience, and often we very much prep people that, you know, you're trying to get to the roots of your depression here, and that there is learning, you know, even in the pain. So it's very much, you know, can you be with the pain? Can you go into the suffering? So often people do have cathartic or emotional breakthroughs, and that is through often a challenging experience. But again, it's about the meaning they make, what they take from it, and maybe, you know, like trauma, you've had something awful happen to you in the past, but there's this opportunity for a reparative experience because you have two hopefully lovely guides next to you who are alongside you, attuning to you if you're struggling, if you need support. So if, you know, if you're going to face the dragon, then you've got your aides alongside you. So we just never really frame it as a bad trip. We just see it as something challenging from which you can learn. And I think the whole model around depression is that we're afraid of our pain, and it's very much learning to be able to sit with and express and feel our pain in you know, and I think that's the beginning of the process, the therapeutic process that starts to open up with the psychedelic session. And that's something we very much foster going forward. It's that capacity to sit with your pain and to grow and learn from it.
So beautifully answered, Michelle. And I'm just going to ask one more question of you, Leonie, before I open up, because we've got a bunch of questions for all of that. I think all of our panelists will be able to contribute to. I saw a question in the Q&A about sort of ongoing care, and maybe, I don't know if you want to speak a little bit about what you've engaged in after, like how you've kind of taken forward the messages that you learned during the trial into your life and integrated that.
Yeah, absolutely. I think the extent the trial didn't offer a lot of ongoing care because of the nature of the trial and the limitations to the study. But we had a remarkable opportunity to have, because of lockdown and Zoom, which came in just after the trial, to have some Zoom calls with Michelle and with Ros Watts. And I think for me, we started realizing the importance of group support, and not just therapeutic, but actually people who had a shared experience, because of the fact that this is illegal largely and taboo in many respects. There are very few people that can really understand how you've gone to those places and what you've experienced. So part of my integrating has been speaking to others who've gone through the same process, and then supplementing a daily practice, really. A lot of time for meditation, reflection, body things has been something that's been really important post the trial. So really trying to get back into my body after being in my head for so long. Picking up yoga practices, stretching, mindfulness-based activities. And that's where the work is. It really is. It's, you know, over in 6 hours in the labs, but yeah, years of work.
Yeah, yeah. I often think of it as sort of psilocybin therapy opens a door, but you then have to walk through that door and you have to continue walking that path.